We know that 77% of SafelyYou detections have a mobility aid present during a fall event. I think this makes sense to many of us, right, that work in senior living. Most folks do require an assistive device to help keep them safe when moving about. Here's kind of the breakdown of what those mobility aids are. So we see 27% being the four-wheeled walker, 20% that two-wheeled walker, and actually 52% of the time we see it being a wheelchair. What I want to call out here is we do see that 54% of the time that wheelchair is unlocked during a self-transfer. Wendy, I know you and I have watched so many fall events, you know, where unfortunately this is contributing. So I think a lot of opportunity here, right, for staff training in not only placement of that device, but making sure it's locked, evaluating our residents, making sure cognitively it is appropriate to have that wheelchair accessible to them. We also know that 43% of the time that mobility aid is out of reach. Now, this may be intentional, right? Maybe we know a resident is unsafe to transfer, but really thinking this through and care planning where that device should be. 39% of the time, those mobility aids are properly placed at the bedside or near a chair. But what's pretty interesting here to note that 70% of those observed using the aid are falling with it, right? So it's present at the time of the fall, actually contributing to the event. Dr. Zhang, pulling you in here, I know we've talked a lot about, you know, maybe we're overusing devices a little bit for some of these folks, particularly in memory care. You know, is it helping or hurting, or are we maybe, you know, is there some opportunity to evaluate if it's even appropriate at all?
That's right. I think sort of the de facto way to take care of folks is, well, you know, when we transport someone, we're using a wheelchair, and then we leave the wheelchair sort of close to the bedside, right? But what we've observed is the individual may not have the ability, especially the cognitive ability in folks with dementia, to actually maneuver and manage the equipment. So then in that case, that equipment itself is actually may contribute to their falls. So before we leave any of the devices around at the bedside or in the room, we really want to make sure they know how to use them.